Let me show you one of the craziest things I've ever seen in an operating room.
California doctor under investigation for attending virtual traffic court while operating on a patient.
Are you available for trial? It kind of looks like you're in an operating room right now.
I am, sir. I'm in an operating room. Yes, I'm available for trial.
Sworn in by the clerk with blood on his surgical gloves.
This surgeon appeared in court over Zoom while scrubbed in and operating on a patient.
So unless I'm mistaken, I'm seeing a defendant that's in the middle of an operating room appearing to be actively engaged in providing services to a patient. Is that correct, Mr. Green?
The judge says Mr. and not doctor. Surgeons get a God complex real quick, and this judge reminds the surgeon that he's just a regular defendant in court.
I do not feel comfortable for the welfare of a patient if you're in the process of operating.
I have another surgeon right here who's doing the surgery with me, so I can stand here and allow them to do the surgery also.
Not at all. I don't think so. I don't think that's appropriate. We want to keep people healthy. We want to keep them alive. That's important.
I don't think this put any patient at risk. I don't think it's a HIPAA violation, and it's certainly not malpractice in my opinion, but it certainly shows a lack of respect for the court and the judge. Whether or not this surgeon, or quite frankly me or any other surgeon, thinks this is right or wrong doesn't matter. Most non-surgeons viewing this video thought it was inappropriate.
When it was apparent the judge was not having it.
Yeah, who can blame him?
I don't blame him at all. Wow.
Let's give him a chance to respond.
About halfway through it, through all the critical parts.
Dr. Green answered the call from the OR, having already handed the case over to a fellow he was training.
He's right. I've done entire cases as a fellow without the attending surgeon in the room. You don't have to be there.
To me, taking a call in the OR is something that occurs all the time.
Yeah, I've taken phone calls too, but if it's not about patient care, I wait until the end of the case.
The doctor admits it would have been better to step out of the room.
In hindsight, honestly, that would have been the simplest thing to do.
He says it would have been the simplest thing to do, not the best thing or the right thing to do. He expresses no regret. Nobody was harmed or in danger during the phone call, but the nearly unanimous public opinion was that this was inappropriate or at least disrespectful.
To me, this has been a great outpouring of judgment, followed by a great outpouring of love.
There's a trap surgeons fall into. We're surrounded by people who tell us that we're amazing and we're never wrong. So this is a great example of selective surgeon hearing. Don't focus on the haters, just focus on the love. So let's hear that last part again and evaluate just how genuine that sounds.
And at the end of the day, the love's what I'm grateful for.
Listen, if a national talk show and the entire internet thinks something you did was inappropriate, maybe that's a good opportunity to be a little more self-reflective.